Next time you get a headache, you'll probably reach for a pill, swallow it, and forget about it within 10 minutes. You won't think about what's in it, where it came from, or why it works. It'll just work quietly in the background of your day. Now imagine you're a Neanderthal, roughly 50,000 years ago, and you have a dental abscess so bad it's affecting how you chew. There's no pharmacy. There's no writing, no medicine cabinet, not even a settled village. Just you, a cave, and whatever grows nearby. What do you do? The obvious answer is probably nothing. Suffer, maybe die, maybe get lucky. That's the assumption most of us carry, that real medicine starts with civilization, with doctors, with written knowledge. Everything before that was superstition and guesswork. Except that assumption is wrong, and the evidence for exactly how wrong it is has been sitting in fossilized dental plaque. 2012, researchers analyzing calcified dental calculus from Neanderthal remains at El Cedron Cave in northern Spain found something nobody expected. One individual, dated to between roughly 47 and 50,000 years ago, had chemical traces in their teeth of two specific plants, yarrow and chamomile. Both are bitter. Both have essentially zero nutritional value. Researchers already knew from genetic testing that this particular Neanderthal population could taste bitterness clearly, meaning they weren't eating these plants by accident, and they definitely weren't eating them because they tasted good. That same individual's dental plaque also contained traces of poplar, a tree whose bark contained salicin, the exact compound that would later be chemically modified into aspirin. And alongside the poplar, scientists found evidence of a penicillium fungus, the same genus of mold that, tens of thousands of years later, a scientist named Alexander Fleming would isolate to create penicillin. This Neanderthal appears to have been in genuine pain. Evidence points to a dental abscess and an intestinal parasite, and appears to have been self-medicating with a real working painkiller and a natural antimicrobial, roughly 48,000 years before either compound had a name. Now here's where it gets complicated, because the story doesn't stop at "isn't that amazing?" Some researchers push back hard on how impressive this actually is, because self-medication isn't unique to humans or even to our ancient relatives. It's called zoopharmacognosy, and it's been documented in over 500 plant species, used by wild chimpanzees, gorillas, and other primates. Swallowing bitter leaves whole to physically scrape out intestinal parasites, chewing pith to relieve stomach pain, even fumigating nests with aromatic plants. So maybe what that Neanderthal was doing wasn't advanced medical reasoning at all. Maybe it was just an old mammalian instinct, inherited rather than invented. The same behavior chimpanzees still perform on pure instinct, with no understanding of chemistry whatsoever. Which raises the real question this video is actually about. At what point does instinctive self-medication become something else? Something closer to what we'd actually recognize as medicine? The answer starts to show up the moment humans begin doing something no chimpanzee has ever done: writing it down. By around 2600 BCE, Mesopotamian healers had developed a documented pharmaceutical system consisting of roughly 1,000 distinct herbal remedies. Surviving lexicon called the Uruana lists about 1,300 plant drug terms, describing something like 340 separate plants, collected, cataloged, and cross-referenced by people whose job title is Su, is the earliest recorded word for physician anywhere on Earth, dating back to around 2500 BCE. These weren't vague folk remedies passed down as vibes. A surviving prescription for a facial wound instructs the healer, step by step, to pound together fir turpentine, pine turpentine, tamarisk, daisy, and flour, mix it with milk and beer, spread it on the skin, and bind it. That instruction is nearly 4,000 years old, and it reads almost exactly like a modern recipe. Wound care followed a strict three-step method: wash, plaster, bind, repeated so consistently across surviving tablets that historians describe it as the standard protocol of the time. Their antiseptics combined alcohol, honey, and myrrh, three ingredients modern science has since confirmed genuinely do have antimicrobial properties. It wasn't just Mesopotamia working this out independently. Ancient Egyptian medicine cataloged around 160 distinct plant-based treatments in texts like the Ebers Papyrus, which also happens to contain the very first documented description of diabetes in human history. Two unconnected river valley civilizations, roughly the same era, independently arriving at organized, cataloged, repeatable plant-based medicine. But real medicine wasn't only about plants. It also meant surgery, and the evidence for that is written directly into human bone. Trepanation, cutting or drilling a hole into a living human skull, is one of the oldest known surgical procedures on Earth, with the first confirmed example dating back to around 5000 BCE in what's now France. It sounds horrifying. It should sound horrifying. And yet the evidence shows something remarkable. Many trepan skulls show smooth, remodeled bone around the opening, meaning the patient didn't just survive the surgery, they lived on for months, sometimes years after. Across different studies of prehistoric and ancient populations, survival estimates for this operation, based on the amount of bone healing found, land somewhere between 50 and 63%. For a surgery performed with stone tools, with no anesthesia, no understanding of infection, and no antibiotics, that survival rate is almost impossible to believe. But the bone doesn't lie. Most common site for these operations was the side of the skull, exactly where you'd expect a blow from a stone weapon to land, suggesting some trepanations were emergency battlefield trauma care, cutting into the skull to relieve pressure from a fracture or a bleed. but other cases don't match trauma at all. Some skulls show small, repeated shallow scrapes, often found buried alongside ritual objects, hinting at something entirely different, a treatment for a condition that leaves no mark on bone at all, something like chronic migraines or seizures, or a mental illness that a Neolithic community had no other framework to explain, except through the skull itself. And that's the moment where practical medicine and supernatural belief stop being two separate stories and reveal themselves as the exact same story, told twice. Because in Mesopotamia, the same society that produced detailed pharmaceutical prescriptions also genuinely believed that disease could be caused by a god physically reaching out and seizing a person, or a wandering ghost forcing its way into a body. There were designated priests for exactly this, different specialists for demonic possession, for ghost sickness, for divine punishment, each with their own ritual. Remarkably, both systems were often applied to the very same patient, at the very same time, by the very same healer. A Babylonian doctor would grind a real medicinal plant while reciting an incantation over it, seeing absolutely no contradiction between the pharmacology and the prayer. To them, illness wasn't purely physical or purely spiritual. It was both simultaneously, and a complete treatment had to address both halves at once. That dual system didn't just explain sickness. It shaped how ancient societies treated the sick, because if illness could be caused by moral failure or divine punishment, then the person suffering from it could become something to fear, not just someone to help. So when you ask what ancient humans did when they got sick, the honest answer is everything all at once. They chewed bitter bark because it genuinely killed pain 48,000 years before that compound had a name. They wrote down thousands of working prescriptions, tested and repeated across centuries. They cut into living skulls with stone tools, and somehow, more often than not, the patient walked away. And in that very same breath, they buried charms beneath their doorways and blamed the sick for angering forces they couldn't see. I'd like to draw a clean line between superstition and science, between the ancient world and the modern one. But that dental plaque from a cave in northern Spain says otherwise. Somewhere in a Neanderthal's aching jaw, tens of thousands of years before anyone could explain why it worked, the very first idea of medicine was already alive. We didn't invent the impulse to heal. We just eventually figured out why it worked.